ahead and call Health Committee meeting to order. Let's stand for the invocation. Father, thank you for granting safe travels for all our counselors that are here today, and we're thankful for the families they represent. Father, we pray you give us discernment and wisdom to make the proper decisions, and that it would be pleasing in your eyes. Thank you again for this special time in Jesus' name. Amen. Roll call, Shelley.
Yes, sir. Mike Dobbins.
Here.
Dora Petzkowski. Here. Sasha Black Fox Qualls. Here. Danny Callison. Here. Julia Coates. Here. Joe Deere. Here. Kevin Easley. Lisa Hall. Here. Johnny Kidwell. Here. Daryl Legg. Here. Cody Poindexter. Hi. Joshua Sam. Here. Mike Shambaugh. Here. Melvina Shotpouch. E.O. Smith. Here. Condessa Teehee. Victoria Vasquez. We have a quorum.
Thank you, Shelley. Moving on to reports, we see Mr. George Vallier is going to come and give a report from the Claremore Service Unit. Oh, okay. Before you say anything, George, I would entertain a motion to approve the minutes. Okay. Minutes have been approved. Okay, now, George, welcome.
Good afternoon.
Well, George.
First off, the tornado that came through Claremore, the hospital did pretty well. The biggest issue we had was loss of electricity for about 16 hours, but the city had us up by about 5:30. Then on Sunday afternoon, we were back in business. Several employees had damage to homes, to their vehicles, and relatives that got hit. But so, been helping those folks, trying to give them as many resources as we can out in public. So we've been working through that. We started a committee there at the hospital. We just this last year had a nurse receive the Daisy Award. So the nursing staff pulled together a Daisy Award committee so that we can at least get our nurses nominated and in the running for those awards. It's a pretty prestigious award. On the flip side of things, our dental assistants, we're down, we're 5 short. We're offering sign-on bonuses. I don't know if you guys are having the same issue with dental assistants, but that's one that, and you'll notice that in your packet. Since that came out, we lost 2 more. I think it shows 3 in there, so we've lost a couple more. And one of the things we've started doing at the hospital is the entire leadership team is going through and taking healthcare compliance training, and we're going to try to all get certified in the healthcare compliance arena, and just raise the bar and help us there at the hospital as we go forward. Any questions?
Questions for George? George, the number of dental assistants you're losing, is there a common denominator why they're leaving?
No, we've been looking at it. We've been trying to figure that out. We've been down 3 or 4 for quite a while, and we got one, and she didn't stay very long. We got a couple, and they didn't stay very long. So we're still digging down into that.
Okay. Didn't know whether compensation was an issue or not.
Well, it is. I think it is, because dental assistants in the federal government are not paid very well. But they just got a pay raise. The Indian Health Service raised the scale for the dental assistants. So we're going to have to dig down a little bit deeper and see what other factors are involved.
Andy?
George, do you guys not have generators at your hospital that keeps you up, or is that just something?
Oh, we do.
Oh, okay, you
I
said
would
you
just, I
lost
would just let you know
electricity.
that the city was off for that long. Our generator kicked in and we were still in business. Yeah, absolutely, absolutely.
Mike?
How many dental chairs do you have in your dental clinic? How many?
12,
12?
yes.
That's pretty good. And has this been a problem that's just cropped up, or is this something that's been like this forever?
It's been, ever since we started ramping up after COVID, we've had issues getting dental assistance. We offer sign-on bonuses, trying to get dental assistants to come on. I don't know what else.
Yeah.
What
How
else?
many do they usually, I guess they're busy all day, all of them?
Yeah.
They're pretty full, just
Yes, sir.
24/7? Okay.
Yes, sir.
Yeah. Maybe burnout.
Could be.
Yeah. All right. Thanks, sir.
Well, I know the private sector, the dentists they're paying a lot more than than
Oh,
he or
yeah.
she wants to, but, it's just, it's not only in the dental field, in the service sectors everywhere, they're having to really try to compete with
Yes, sir.
a lot of folks. Sasha?
George, do you offer any retention or like any assistance for dental assistant school and then a service payback?
IHS has payback for, that if they would come to work there, then they can apply for that, and then they're eligible. We, as the hospital, don't have any say in who gets approved for that payback, but it's an agency program. So if they come to work for us, they're eligible for that and can apply for that payback. Yes,
And those that are interested in applying, is that on the ihs.gov website? Just
Yes.
for those that are listening?
I think so.
Okay.
Yes.
Thank you.
So you're saying that IHS now has scholarships for dental assistants? Is that what you're saying? And
Not-
with a
I don't-
service payback?
I'm not sure if they have
Does that be new?
scholarships for dental assistants. I'll have to check. That's a good question.
Yeah.
I'll check on that.
Okay. Okay. Looks like we're good, George.
Thank you.
Thank you. From Cherokee Nation Health Services, Dr. Steve Jones.
Good afternoon.
Good afternoon.
The report is in your packet, and we can address any questions here in a few minutes. I wanted to go over a couple of things before. The construction, all the construction projects we've got are all on track. Storms didn't do any damage to any of those projects going on. We lost a few trees at a couple of the clinics, but no real damage anywhere. I was told to keep things a little shorter today, so I'm going to just talk about a few things. We had pretty good week, or a good week last week, or week before last, with the hospital week, and we acknowledged and did some things with fun things with the staff, and we fed them every day. We had food trucks there, and they were able to go out and socialize a little bit and get their meals paid for that week. We did some games and things like that to acknowledge them. We've had several graduations through the last couple of weeks, and the last month since we've been here before. Most notable of those was our graduating class, our first class from the OSU Medical School. So many of you were involved in some of those festivities, but that was a huge accomplishment for Cherokee Nation, and a bright future for a lot of students coming through that process. Most recently, we did the Surge Tech program last week, so the end of last week. So we've got a lot of things that we're connected to, that we're attending and keeping track of these students as they go through, and seeing if we can't find places in Cherokee Nation for them to continue their career. The last thing I want to point out, I told you we'd have some numbers. We've got some numbers on some of our numbers of patients being seen in our programs. Overall, we went back to 2020 and started looking forward at each year and how much we've grown or expanded or our growth for patient visits. And overall, the average is 17% per year compounding. So if you think about that, each year you add 17%, then you add 17% on top of that total, and it just keeps compounding. This year, we're probably going to break that number. It looks like we're headed, based on the numbers up through the end of April, to somewhere around 1.97 million patient visits, so almost 2 million. We may make the 2 million mark for the first time this year for patient visits. Overall, every service line is increasing. We don't have any service lines that are decreasing anywhere. The biggest line of increase has been in dental, and mainly because we added NOWADA and we added doubled the size of the clinic in Oshaleta. So that's been a big increase in patient visits, and they continue to, doesn't seem like the more we add, they stay completely booked up. So we thought it would take a little pressure off Veneta and some of the clinics up there when we added NOWADA, but it hasn't. There hasn't been a decrease anywhere. So we just found a whole new set of patients that weren't getting served that are now getting served. So, so anyway, that continues to grow. I know there was a discussion about dental assistants. We're not having many problems. The only clinic I know of that we have a little bit of problem with dental assistants, and we've had some openings for quite some time and had trouble recruiting, is in Veneta. Other than that, all of our clinics are staffed accordingly and not outside the normal turnover that you have. But to answer the question about scholarship, I don't know of any scholarships available for dental assistants. Dental assistants typically are on-the-job training. You start them out and you train them and then send them to different courses to get certifications, in which we do help them with that, and they do get recognition for that in their pay. Whenever they do get those certifications, it bumps their pay each certification. We feel like that helps the dentist be more efficient, so as they're more efficient, then we should be able to pay more. So we do have that career ladder, so to speak, in place in our system. So hopefully that answers some questions about our dental assistants. After that, I don't have anything else for you. I'll be glad to answer questions.
Dr. Jones, out of all the graduates from the OSU Medical Center, do you know how many we are going to retain?
Well, the next step is residencies. You know, they go to residency after they finish med school.
Got you.
And so the residency process is a little different. You don't just go hire those people. They go visit what specialty they're wanting to go into. And then there's a thing called match. And so you interview these prospective residents, and you pick your order of which ones you want. They pick their order of where they want to go. And if you match, they come. So there's not a process of I want you and I want you, but you have to want me too. And so as that process goes through, then we'll get our residents for this next year. We have family practice and we have pediatrics currently on our campus, and then we work with Northeastern Health Systems for internal medicine. We have intention on adding at least 3, maybe 5 residencies in different disciplines over the next 2 years as the hospital gets closer to being built. And that's going to open up more docs to stay in this area. But I don't know the exact number on how many of those students matched with us. I don't think that gets, maybe this month we'll know all those numbers. I know our residency filled up. We got applicants that matched for all of our positions that we offered. So, but I don't know where they came from yet. Yeah.
Dr. Jones, I thought the going 10-hour shifts where you're at the clinics was a great idea. Has it been beneficial to you guys? Have you all seen any numbers of anything up to this point?
I don't know that the numbers are out yet. I expect to see bigger numbers on patient access because of it, because we do essentially open up more hours of the day. We didn't change and take away any hours anywhere. It just expanded the hours. But with that, you also are splitting up your staffs, because some staff are going to work some days, some aren't going to work the other days. So we're hoping with that splitting of staff and more square footage to work in, so to speak, that the efficiencies will come along with that. I suspect that when we get the numbers in for June and July, we'll start to see it. We didn't start it till the April. So we're not seeing those numbers yet, because the report I gave you today was for April. So we'll know something by, probably be able to report to you in July and August on what those numbers are. Staff likes it. The ones that are participating in it, I have had no negative feedback. The only feedback we've had is some people that wish they could do it, but because of their circumstances, they just can't, and want to when that circumstance changes. So we've been able to accommodate all those that we can and still keep our services open. We have some rules around it, that no service line gets past a certain level of availability to patients. So even if you can't have everybody off on Friday. Everybody can't be off on Monday. You got to split it up so that the service lines all stay fully functional and fully efficient. So far it's working out smooth and great. We haven't had any obstacles yet. Yeah.
Dr. Jones, thanks for being here today. I just have a quick question. I've been reading in the news about the recent Supreme Court decision where they weighed in on behalf of a couple of tribes against the IHS in a funding dispute where the government was going to have to provide or mandated to provide more funding for those tribes for their health care. Is there a ripple effect that could impact our funding streams? And how are we impacted at all? And this might be a question George Valier might be able to answer this as well, but I thought I'd get your take on what your thought is on that Supreme Court decision and how it impacts Cherokee Nation.
Yeah, absolutely. So this is a question more for probably government relations and our legal system to give you the detailed answer for that. I can give you kind of our view of it. There was a brief that was filed to hold our position in this lawsuit when it was filed so that we didn't lose anything due to time limitations. So I do know that, and I think it goes back to 2017 if I am informed correctly. It will help us because what it did is it makes eligible for reimbursement for any contract support cost associated with third-party billing. So you can look back and see what are your expenses that go along with what we're having to do to be able to collect on third-party, and those are going to be eligible for reimbursement. And that's my simplified understanding. There's probably a lot more detail to it than that as this works its way through the courts and the AG's office and government relations briefs us on what it is that we're entirely eligible for. I'll know more about it. But I did speak with our finance person, and it is definitely a positive for us, definitely a positive. Because we've been shouldering that burden or those expenses all along, so with no reimbursement for that. So.
Thank you, Chair. Dr. Jones. Yes. Quick question. I heard you say, I believe, that Veneta has a shortage of dental assistants. How many are we needing?
I don't know the number right exactly now. I know that there has been a shortage in the past. We have hired a few recently. Okay. So I'm not sure what that number is. I can get it for you, but I'm not absolutely sure what that number is off the top of my head.
More than the number, to me, I would just be curious about if our level of care has dropped because of that. So
no, typically what we do is pull from other clinics. So if there's a shortage and we have a doc and he doesn't have enough assistance that day, then we move them from another clinic up to help. So having it all under one umbrella that's the advantage, because you know what's going on in every clinic and you can help push people where you need to. And that's part of standardizing everything. So when someone walks in another clinic, it's not a new process they have to learn. They're doing the exact same process they were doing at their clinic. So a lot of cross-training goes on in that in preparation for shortages like this.
Sounds good.
Yeah,
thank you.
you're
Thank you,
welcome.
Chair.
Well, there used to be some dental assistant schools here and there, and it just wasn't sustainable.
No, because everybody works differently.
Yeah.
So, yeah.
Yeah, us, private docs, they prefer just to train dental assistant the way they want them to be trained.
Right.
And the private docs tell me that they can get a hygienist anytime. The market is, because we have dental hygiene schools at OU, obviously, at Bartlesville, Tulsa Community College, Weatherford, Ardmore, and you may not have heard, their OU Dental Administration is thinking about opening another branch in Enid,
Really?
a dental hygiene school, yeah. So, anyway,
Yeah, we don't have any shortage of dental hygienists. And, you know, it goes back to all the processes. What, you know, having experience in private practice versus Cherokee Nation, we do quite a bit more with regulations and with things that we have to follow in our setting because we fall under CMS and under the hospital rules rather than outpatient rules. So even at all of our outpatient clinics. So because of that, it's a little different training, and it's better if we can train them from the beginning rather than coming in and having their own way of doing things and then not following the right process.
yeah. Joe?
Are we still doing the appointments where you got like 30 minutes to call in on Wednesdays to try to get an appointment?
Well, it's not 30 minutes. It opens up every Wednesday.
Yeah,
but
something like
those-
that.
But those appointments do fill up because every doc is required to do 4 new patient visits a day.
Mm-hmm.
Okay, so when they're required to do that, we open it up for 1 month in advance every week for a week, 1 month away. So however many docs are scheduled across our system, times that times, you know, 16 patients a day or a week per doc gets new patient visits. Now, for regular visits, or if you have an emergency or a same-day visit, you can walk in at any clinic and get that, right up until closing time. We have a policy that if you get there and we're there, we're going to see you. If we have to stay late, we're going to see you. So for acute care, for emergency care, for anything like that, you can walk in at any clinic at any time and you can get seen. Now, will you get a full exam and get everything done that you want done? Probably not. That's going through the process of going through all the new patient diagnostic things that you have to do to get a patient treatment plan. And then once you get in the system, if you stay in the system, you don't fall out. You don't quit coming to your appointments. You come for your routine exams. You come for your cleanings. You never have to go through that process again. You stay in that system for as long as you want to be in it. But the initial getting in the system is a little difficult because, for one, we do, in my opinion, great care. And so people are really wanting in our system, and that hasn't always been the case. So it is a challenge to get in that initial visit, but once you're in that visit, if you'll just do your part, everything will be taken care of for as long as you want to be in it.
So what is that timeline on Wednesdays that they should call?
They open those appointments, I want to say, at 4 o'clock every Wednesday,
Till
they either fill them,
they fill up?
until they fill up, or.
And that's for
till-
1 month, right? Correct?
Mhm.
And that's
Yeah,
as
1
far out
month
as they go?
ahead, yeah.
Okay.
And we found, and you know, I was in the dental part when we did this, so we did all kinds of studies to find out how people keep their appointments. Because the problem was, if you book out too far, people forget about it and they don't keep their appointment, then you wasted that time that someone else could have had.
Right.
So we found that this was the sweet spot. If you don't go more than 30 days, people will keep their appointments. If you go past that, they don't keep their appointments. Now, I do encourage every clinic to keep a short call list. So if they have somebody that falls out and they need to fill an appointment, then they start calling down that short call list and try to fill it with someone else. They're all incentivized based on their productivity. So if they are sitting at their desk not doing work, they're not getting paid as much as the person who is working and seeing patients all day. So they're incentivized to keep those schedules full. So that repeat short list is used pretty often.
All right, thank you.
Yeah.
That's all I had.
Sasha?
Thank you. You mentioned being incentivized for seeing X number of patients. Are they penalized in any way if they don't meet that number of RVUs?
They are. If their next year's salary can be reduced, or if they are below a certain threshold and we don't feel like they are fulfilling what they need to be doing to be in our system, then yes, their contract could be not renewed.
Has that affected any of our retention of dentists?
No, as a matter of fact, we have people waiting to get into openings. So I feel like we have a very good incentive package, and every time we have a dental position that comes open, it's immediately filled within 30 days. I mean, people are, let me know when you have an opening, I want to come work for you. So.
Okay. And to follow up on the appointments, Are they still on a separate system that they're not getting the appointment reminders such as health services?
Now, we just started that with health services, and there is a separate system that is dedicated just to Dentrex, because Dentrex and Cerner do not mesh. We have two different systems for two different disciplines, and that system's being evaluated. It's in the testing phase before we roll it out. So as soon as we get it all tested and everything is working the way it's supposed to, and people aren't getting someone else's appointment reminders, we know that for a fact we can roll it out, and we'll be rolling it out for dental too.
Okay, thank you. Thank you, Chair.
Anyone else? Thank you, Dr. Jones.
All right, thank you.
From Public Health, Ms. Lisa Pivek.
CO, everyone, good to see you today. Happy to be here. You have my report, our report in front of you. If you have any questions, only just a couple of things to mention quickly. This Thursday is the Youth Summit, Know Your Nation, for grades 7 through 12. That is in partnership with Education and Government Relations, held at the Chota Center. So all the details are online at our Facebook page and Cherokee Nation Facebook page, and we sure appreciate that collaboration. There's no way we could do it without those other two divisions participating and helping us. A couple of other quick things. We had the cancer conference last Thursday at Chota Center. Went very well, and wanted to give a big thank you to the other divisions across the tribe that helped us. Health Services was a big part of that, and as well as environmental services, environmental programs. And the last thing before I take questions to mention, as you all know, SEBT is still rolling along, lots of questions. If you have any questions from your constituents, please don't hesitate to get a hold of me. We are launching the Muskogee Creek Nation portion of the SEBT this week and next week, which will start another round of 30 to 40,000 on the first batch, and so on. So very busy, and also with Farmers Market, very busy at this time of year, and then all the other things that you see going on the report. So happy to field any questions or take any comments.
Johnny?
Ma'am, thanks for being here today. Noticing on your report where it talks about the nation benefits of the SEBTC program, 4,227 students. That's how many have already gotten signed up into that program on the Gadoogie portal?
That was actually that batch that the staff reported. We've
Okay.
actually served over 55, close to 60,000 students at this point.
Wow, unbelievable. 60,000 students.
Yeah.
Great job. Thank you very much.
Thank you.
Anybody else for Lisa? Looks like we're good. Thank you,
Thank you.
Lisa.
Mhm.
Thank you for your report. It was very exhaustive.
Thanks.
And Dr. Jones and George as well, but appreciate the report you brought. Okay, under old business. See none pending, new business, none pending. Announcements, be mindful that this is where we are going to meet all in one day in July. July 15th at 1 is when the next health committee is scheduled. Any other announcements? Need one more motion.